Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today we are doing a first, which is taping something to be added to the front end of something scheduled to air later this week. And the reason we're doing that is because an article came out in the New York Times yesterday. Administration staves off sticker shock on Medicare drug premiums. So I have to admit, I was not aware that the administration is funneling billions of dollars to support Medicare drug programs to make sure premium increases are somewhat moderated. And this article, and we'll put a link in the copy, calls it a savvy response. Well, I'm not so sure about that, but it's clearly, all of this is so political. Cutting the out-of-pocket max, well, going from not having one to having one this year to reducing it to $2,000 was very aggressive, and it probably was not fully thought through what impact would be on premiums. So the fact is, it's going to be several rocky years, so you should be looking at this. Today is September 30th. Tomorrow, the plan information as well as premium information should be available on Medicare.gov, but give it a week. Let all the kinks get sorted out, but look at it. And frankly, I would say look at it for the next several years. Even if you're on inexpensive drugs, the premiums are going to vary so widely that you want to know what the market is like in your area. All right. Let me just read one quote from this. The administration came up with this Part D demonstration in order to shovel billions of dollars more into the program to mask the huge premium increases that would be coming next year without it. So of course, that's from someone who served in the Trump administration, but regardless of your politics, be aware that all of this is very political, and you can understand that the Democrats didn't want, I think 50 million people, according to this article, are on drug programs, 50 million people getting huge premium increases and being notified of them the month before a presidential election. So anyway, good luck. What can I say? It's more complicated than it really needs to be. And today I'm going to talk about people who are on individual Part D plans and who are on individual Advantage plans that cover drugs, and most do. These changes affect others, like those on retiree medical, in different ways, but we're not going to talk about that today. So the major change is that the out-of-pocket maximum for Part D for drugs is going to be $2,000 per person. And remember, we've talked about this before, this year, 2024, is the first year there has ever been an out-of-pocket maximum for Part D. From 2006, when the program began, through 2023, there was no out-of-pocket maximum. So 2024 represents a significant improvement in that respect, but primarily benefiting those on very expensive drugs. With the out-of-pocket maximum going down to as low as $2,000, that is a major change, and you would expect plans to be looking to change their premiums, change their co-payments, implement changes, and they'll differ by plan. That's why you've got to look at your options, and sometimes they'll surprise you. For example, if you go back to 2023, and let's use New York, New York City as an example. If you go back to 2023, a plan like WellCare Value Script in New York City had the second lowest monthly premium of $11.20. There was another plan that had a $10.90 monthly premium. And then, of course, you have plans, the premium goes up from there. Some plans are over $100 a month, and that can make sense if you're on an expensive drug and that plan's formulary includes the expensive drug, but that's why you have to run the numbers. Now, this year, 2024, WellCare Value Script lowered its premium, which is counterintuitive. So in New York City, the monthly premium was lowered to $3.70 a month, and in other locations as low as 50 cents. In some locations, no premium, a zero premium plan. Anyway, this may have been a move by WellCare to increase market share, right? And so everyone should be watching closely how the plans respond to these changes. It's still in September when I'm taping this, so we don't have them yet. But information will be out in early October for open enrollment beginning October 15th and ending December 7th for a January 1 effective date. So be aware, major changes on the horizon. All right, thank you for listening. Take care. We'll see you soon. Bye-bye.